Welcome back to the show. We are talking about gastritis today. That is the main topic for today. So doctor, as we were talking before, and to add a little bit more to what we were talking about, the stress element, how does this connect to having gastritis?
Well, that's a very good question, and it's a very difficult question to answer actually, because what stress is very difficult to quantify. I mean, if you talk scientifically, because some people, what may be stress for you may not be stress for me. So it's very difficult to quantify that.
Yeah.
Having said that, it's known that stress definitely increases acid secretion, but whether really stress, and there is something called stress ulcers that form, that is documented in patients who are in the ICU, who are ill. So definitely stress plays a role, but it's very difficult to quantify that and put it into scientific sort of terms. So that's the only thing, but definitely it plays a role.
Of course, and so keeping the stress levels lower in your life can help you to control gastritis as well.
Yeah, well, like really scientifically you can't prove that, as I said, but definitely it has a role, and overall stress is something we should avoid in any case.
Of course.
So it depends from person to person, I should say.
Yeah, I mean it's difficult. Of course, major life events like death of a loved one or something, that is stress to anyone. But certain other things, maybe getting late for work may be stress for me, but it may not be stress for you all. Or vice versa.
Definitely is when you have to go on TV. But,
so it always depends from person to person, as I always said. This is a question that could be perceived by so many people out of any gender, any kind of age barrier. How do you actually differentiate a gastritis pain from a heart attack pain?
Yeah, I think again a very, very relevant question.
Yeah.
Because it's very difficult. The answer to that is there are certain things. For instance, if you have, they both can have central sort of, as you said, heartburn, which is like a central pain, and it both may be brought on by food. But if it's a heart pain, sometimes it goes down the left arm. Generally, it can go to the jaw. Those are sort of very. If it goes to the jaw, it's almost certain to be a heart pain. Then
but both the symptoms are almost similar.
Yeah, similar. But so if you are sweating, or if you say you get the pain only when you walk up the stairs or exert yourself, then it's more likely to be heart. So what we always advise patients is don't, especially if they are middle-aged patients, we say don't go for over-the-counter medication and treat yourself. First check out whether it's a heart problem, especially if you've got a family history as well. Once you clear that, because gastritis is not going to kill you, right? But heart issue can, so you must first clear that and then go with that. So that's the advice, is if you have something like that, always clear that with your doctor and then proceed to see whether it's gastritis.
so if I could go back to a point you made, over-the-counter medication, is it the final option for curing gastritis? I mean, do you have to go for that at all? Can you just do it by changing some of the lifestyle factors and food, things like
lifestyle is number one always, right? Lifestyle is number one. Second, then you can go for medication. Over the counter, I mean, in Sri Lanka anything can be over the counter, but that's not normal. Over the counter meaning sort of like antacid syrup. That's what I mean.
it's always better to get a prescription from a doctor.
Yeah, definitely. For anything else, but for those, I mean, even in abroad, you don't need for antacid syrups. You don't need. You can get. So there is a medication to stop acid. They are called proton pump inhibitors, and they stop the acid completely. Very, very effective drugs. So they can stop the symptoms, and with lifestyle measures, that's quite very effective. There is another, for if you have very severe reflux, then there you can go for surgical option as well. There is a picture of that as well. where it's now done either laparoscopically, mainly, which is keyhole surgery, or and even endoscopically it's done, but not in this country as yet. So there is a surgical option as well, but currently the favor is with medical treatment for this reflux, but there is a surgical option as well. So for long-term reflux, if it's gastritis or gastric ulcers, then again it's this proton pump inhibitor medication combined with if it's a bacteria, I said, you got to get rid of the cause. So you need to use a course of antibiotics. Generally it's 2 antibiotics and this antacid drug for about a week. So then that gives good healing. And if it is due to medication, like because you said aspirin, then you should either avoid the medication or continue with proton pump inhibitor. That's what this drug is called.
But if I could just interrupt you there, doctor, I'm guessing a proton pump inhibitor stops the acid from being secreted into the stomach.
Yes.
So would that interrupt your normal digestive process, or are there side effects to these things?
Yeah, well, that's good question. There is it doesn't interrupt digestion that much, but long term, yes, there are side effects in the sense they have. I mean, it's not a cancer risk or anything, but they have been, if you take it for like 15 years, like that, there sometimes it has been associated with hip fractures, rarely things like that. But this is, we are talking long-term medication, like 15 years, like that. So the proton pump inhibitors, you can't say that any drug doesn't have side effects, but so far they have been fairly safe. When I'm talking about this, I'm talking about 15 years, right? So that's important, but the benefit of you combining that with an aspirin or something is far outweighs any side effects it can have. So that's important.
And the other question is, can gastritis lead to something worse like cancer?
Yes, well, it can, because if an ulcer can become a cancer, gastric ulcer.
I see.
And if you have reflux for a long time, you can get something called Barrett's esophagus, which is a name for, to simplify it, the gullet or the esophagus, the lining is sort of white, but what happens is the stomach lining is sort of pinkish color. There is another picture of that as well, so that this changes, and if you have this Barrett's for a long time, in a certain amount of people, it can become a cancer as well, cancer in the esophagus or gullet. You can also get stomach cancers. If you have long-term ulcers, you can get. So that's why we advise, when you do an endoscopy, if you have a gastric ulcer, we always take a biopsy and see whether it is early cancer or whatever. So generally that can happen. So that it's best to treat it early, and endoscopy is very important, especially because if you are thinking of a gastric ulcer.
Many people nowadays, doctor, I'm making it very personal on this. My parents, for example, they don't actually, they try to skip their dinner, but they stick to something very light, a light diet. For example, a soup or a green tea. Would this lead to gastritis, or consumption of something like soup or green tea, especially in the night, is it healthy? Where do you say it going?
Yeah, well, if you shouldn't take a heavy meal, definitely, but I mean, green tea for dinner is not, definitely not the way of, it's not even a way of losing weight, because what's going to happen is you're going to eat more in the morning. So that's not practical. So what they say is, especially if you are reflux, to have 5 small meals a day, break it down. And if you are trying to lose weight, you never cut down the number of meals you have. You just cut down the calories. That's what you do, because if you cut down the meals you have, that single meal you will eat more. Because the simple fact is that during the fasting in Ramadan, no one loses weight. Actually, it has been shown. They don't actually put on weight, but you have one meal. So, I mean, having one meal is not a way of dieting. So that's not on. But definitely, if you have a heavy meal, then there is more. That's not good to sleep immediately after that part.
So your recommendation is to take a moderate meal.
Yeah, everything in moderation.
So
not everything, but
so what's your perfect ideal choice for dinner?
yeah, for dinner would be either some vegetables, definitely, and some source of protein, depending if you are vegetarian, or if you take egg, that's fine. Otherwise, some grilled fish or boiled fish or whatever. And as starch, either potato, or if you want to take rice, just a small bit of rice, or some, if you're taking bread, brown bread, something like that, just one slice.
So that's the way to go if you want to control this. But what if you've already had gastritis and you've suffered with all of these ulcers and acid reflux problems like that? What are the steps that you can take to minimize the damage that has already been done?
Yes, if you have an ulcer already, again, you got to be very careful with your food now. Then, in addition to that, as you said, food, alcohol, smoking, all that has to stop. And then you need to take treatment with proton pump inhibitors for at least 6 weeks. That's the course. And if it's an ulcer, you've got to check whether you have this bacteria. And you should treat that for about a week, because otherwise this ulcer will come back again.
So these are the steps that you have to take if you really want to.
Probably you will need an endoscopy, definitely, to make the one is to confirm the diagnosis, other is, if it's an ulcer, to take a biopsy.
So all of these steps you should actually take after consulting a doctor.
Well,
right?
definitely.
Yes.
I wouldn't recommend the patients doing endoscopies on themselves.
No, definitely not. We don't encourage that on Good Morning Sri Lanka as well. But gastritis is something that's so prevalent in the younger generation. But what about someone who's more elderly and maybe not into invasive surgery or anything like that? What are the steps they can do to make some changes in their lives? Because, as you mentioned, it can go hand in hand with heartburn as well.
I would say definitely first thing is exclude any heart problems, number one. And again, the same lifestyle measures, but the elderly would be taking more medications than, I mean, the young person wouldn't be taking any medications generally. But the elderly, they'll be taking so many medications, they may be taking. So, is all that medication necessary is one thing, and so if it's not necessary, they can stop that. For instance, if they're taking painkillers, they can see whether there's another option, like injecting the joint or something like that.
I see.
Right? Instead of just taking painkillers, you could treat the problem. So that's one. And then, as you said, smoking and alcohol, to stop those. And again, of course, you have to get back to medical treatment there. Surgery definitely wouldn't be an option for an elderly person.
Oh, I see.
But drugs would still be. And endoscopy is relatively, it is an invasive procedure, but is a relatively safe procedure depending on the situation. So that you can still do. Because especially if you're in an elderly patient, you would need the endoscopy more, because chance of having cancer or something is more than in a young person. So that part you have to do, but whether you go for surgery or not will depend.
Alright, so I think Dr. Arjuna and us, we've spoken so much about gastritis, and we've really got a clear perspective about what this disease is.